Stan, we're live.
Thank you, Larry, the Liberty Guy, and welcome to this Thursday edition of In the Dugout. I am your host, Mike Stenhouse, and it just seemed like a Red Sox day today. I don't know why, so we got the Red Sox cap going on In the Dugout today. Okay, today, as with most Thursdays, we're going to be featuring Dr. Andrew Boston. Dr. Boston is the Brown degreed epidemiologist who is now a research and data expert on all things diseases, and he's been one of the few doctors to kind of really put some independent thought into the whole pandemic and to come up with some theories and to promote some ideas that are generally accepted but not generally reported. I like the CT cycle threshold data. That was the subject of a radio show today that we first introduced on this show. Remember, and this is the value of this show, In the Dugout, is we're not afraid to talk about things that the mainstream media doesn't want to talk about. Now, we're not going to ever give you a bunch of unsubstantiated baloney. But we're not afraid to talk about things that need to be talked about. And you're just not going to get that in most places. You know, you saw what happened with WPRO. Their corporate and their corporate head said you can't talk about certain things, right? Well, what's going to be next? Well, we can talk about anything we want to talk about. If we think it's credible, we'll talk to you about it. It doesn't mean it's fact. Doesn't mean it's true. We don't have our own investigative journalism team, but if we read enough reports and get what we feel an issue we're comfortable with, we're going to talk about it. And so that's what happened with Dr. Boston. He was talking about the cycle threshold data before almost anybody in the country was talking about it. And we heard about it here first on this show. Now it's being talked about everywhere, and it's becoming a big national issue. So we're going to have more. He'll be joining us at the second half of the show to talk about Rhode Island COVID updates on the data. We're also going to get a lot of interesting data starting to come in now on vaccines. Some good news, some bad data, or troubling data, I should say. So we'll look at that with him later in the show. I'm going to give you just a minute or two, a quick update on some of our recent discussions, of course, on the DC protests and how that ties into, and the cancel culture, how those things tie in together. And what a lot of people didn't know, we just learned today, there was a very strong anti-China, Chinese people, Chinese Americans apparently, anti-China component to at least the peaceful component of the protest that day at the march and the day before. So we're going to talk to you about that, show you a news clip on that, a news story on that. Then I'm going to talk a few minutes about incoming, pending, whatever the right term. If it's President-elect Biden, what is Dan McKee? Governor in waiting, like a lady in waiting, governor in waiting McKee. Anyway, he had his first press conference today. I didn't get to watch it live, but I did. We do have a Go Local Proud summary of that. And I'm going to go through that with a few comments. And then we'll get to Dr. Boston for the second half of our show. Sound good enough? And then that's what we'll cover today. So thank you for tuning in. And of course, remember, and let's always do this. This is a talk video show. So if you would like to Zoom in, you can go to rifreedom.org/talk. If you would like to just call in, there's the number down there below that, the 646 number, and you can just call in it. And remember, if you are on our Zoom call right now, and if you would like to ask a question or make a comment on the show, just type something in the chat. Say, I'd like to comment about this, very short, just so we know that you're not just watching passively, you'd like to become involved in the show. So just do something, and Larry the Liberty Guy will pick it up, might ask you a question back or something like that, and then we'll get you on the show when Larry the Liberty Guy says you're going to come on the show. Okay, let's move on. So here's so I was talking to someone today who was in DC, only in the first portion. He was there Tuesday, He was there Wednesday, didn't get close to the president, but listened from afar, part of the crowd. By the way, he says the crowd was unbelievably massive and multiple hundreds of thousands. Anyway, whatever that's worth. But he said, one thing that I haven't seen any reports on, but that we and the people I was with noticed were how many Asians were there, organized with banners and almost like tailgating stops and things like that. So I looked around on the internet, and there really wasn't much reporting on this, except I did find this one story that seems to validate what he said. So I find this very interesting. So let's go through this. So what this article says, and again, I don't know this group AmmoLand, and I wouldn't put it up there if it weren't for a trusted person I talked to today who backed this up with his own eyes. He said the most organized pro-Trump group there on January 6th was this anti-CCP, this anti-communist China groups. And here you see some pictures and China, CCCP tyranny. Look at this big organization they have here. Tents. Let's just say Chinese American Alliance for Trump. Here's some individuals. Here's a lot of signage they had up. So truly, this individual we talked to today, Chinese Communist Party is an evil cult. A lot of us believe that. Again, so you can see these are pictures from that day. And you can see the headline here. While there are many smaller groups had organization, but this article claims that the largest and most organized group of people they saw, other than just all the individuals that day, were Chinese people, Asian people, protesting against communist China. Now, by no means am I implying, and by no means did he imply that they were involved in any of the violence. But as far as people being organized for the peaceful protest part of that march, if you would, this anti-CCP component was there in very strong numbers. So I don't really know what to make about it. I think it's very interesting. So if you got a comment, give us a call, zoom on in or whatever. All right. Here's something. Alex Berenson is the former New York Times reporter who basically has, now we're into the cancel culture, who basically has started writing against the conventional wisdom, the line that the government agencies, the World Health Organization, and all the swamp doctors have been telling us. And he's done a great job of independent reporting. Again, no conservative here, but just an honest, independent reporter. And he's talking about this as a titanic shift, where one party, much of the media, private companies, again, not just the tech companies. You've seen the stories about airlines banning people and all kinds of stuff going on. Anybody Trump or Trump associated, it's almost like McCarthyism is going to have a target on their back. Maybe not literally, but they might be banned. They might be canceled from our culture, from business, engaging in commerce, even being a patron to certain places. Punish people for their political views. Folks, this is not America. This is unbelievable. And Alex Berenson is right. It's hard to overstate what a massive shift this is. And this is the danger I've been speaking about for years of the political correct culture. Now they call it wokeness, the politically correct woke progressive left. I mean, these things are like wildfires. This notion goes out, the media, the left jump on it, and all of a sudden it's like, if you don't believe this new crazy idea, you're the crazy one. And it's gotten to the point where it's impacting public policy. It seems to impact law and justice. It's now impacting how businesses conduct themselves and who they will serve. Sure, businesses, have a right to, private businesses have a right, but I don't know that they have a right to collude with government. Corporate socialism, if you would, as I called it the other day. They don't have a right to collude with government to deny us our right. That's where the line gets drawn. So we know what's happened, so we know what's happened with Representative Price, one of our state reps from Richmond, Rhode Island, who just went to the protest, wasn't involved in anything at the Capitol, but they're calling for him to resign because he not only did he go, but he apparently tweeted out that what was on the major news media, not the leftist media, but other major news media, that there may have been, Antifa and BLM led attacks. We still don't know what happened there. What we do know, and as we said, went to some depth yesterday. And again, we were the only people talking about this in Rhode Island. The FBI press conference yesterday said that the violence was pre-planned. It was a conspiracy. The FBI warned the Capitol Police, the New York Police Department tips warned the Capitol Police, but for some reason, is that the Sergeant at Arms? I think the Sergeant at Arms, probably in consultation with Senate Leader McConnell and House Leader Pelosi, decided not to do anything, decided not to call in the National Guard, as was recommended. 6 times they denied the Sergeant at Arms. Anyway, we don't know Pelosi's and McConnell's involvement in this. I think that's part of this fervor for trying to blame Trump. But again, because to cover their own incompetence, their own negligence, and not heeding the warnings. But again, the point we made yesterday, if you're interested in this crazy impeachment, this drive-by impeachment of President Trump, it kills their argument. Not only did his words not incite anything, I mean, there was nothing insightful in his words, but now authorities are telling us this had been pre-planned. How could he incite something, a flash incitement, when it had been in the works outside of anybody's knowledge for weeks or days ahead of time? Again, this rush to judgment, this politically correct wokeness with your blinders on attitude of rushing to condemn and cancel everybody who disagrees with you. We have to let the facts play out. We have to let we see where things go. And before we rush to judgment. I mean, you just don't know what to believe in the media anymore, from the left or the right. I am, just as a kind of a funny right here, it does look like finally the right is pushing back a little bit on the cancel culture. So this is obviously a funny meme, but Texas Governor Greg Abbott has issued a stay-at-home order for all California residents. We don't want your left-leaning views, and we don't want your COVID in our state. So stay at home. You're canceled from coming to the great Lone Star state of Texas. So anyway, that's just a little funny. You almost wish it were true. Okay, let's go to, before we bring on Dr. Boston, let's go to a few things Rhode Island. Nice iced coffee late in the day now. Deal with that cycle downturn you get. What do they call it? Your what's that cycle they call it? Your biorhythms or whatever. Okay. First of all, so incoming Governor McKee has got some major problems to deal with. The first one, which just new data, is education. We listed the failure to reform Rhode Island and especially Providence schools as one of the governor's great failings, and we listed that in our critique of her nomination for Commerce Secretary. So take a look at this map put out. This is put out based on the National Education Assessment score. They come out every year. Dark blue is bad. Dark blue, as you can see here, means that a high percentage of low-income families, what just happened? A high percentage of low-income families or low-income students scored below satisfactory in reading and math. Now look down here. Do you see that blue spot, Rhode Island? It's the only one in the whole Northeast. You got to go all the way down to, let's see, we are right now 44th out of 51. You got all the way down to Delaware before you get 45th, Virginia, also 45th. I guess they were tied. But Rhode Island, 44th out of the 51, including District Columbia. And just look at these numbers. Nope, that's Connecticut. Hold on, you got to get right on Rhode Island, so small. So we spend among the highest, and you see 17,000 per student in public schools. And right there, percentage of lower income eighth graders who scored below basic on the 2019 scores. Reading, 44% below basic in reading, 55% below basic in math. You compare that to the next group below, which is higher income students. That's what we call the educational gap between low income students or minority. You know, you can measure it any different ways. This one's looking at it from a point of view of income. And you can see that down below the difference is there's a 29 percentage point gap in reading and a 35 percentage point gap in Rhode Island. I mean, this is embarrassing. This is embarrassing. We are the only blue dot in this whole Northeast. Pennsylvania, 32. You know, I mean, that's a light blue. So that's one of the big issues that Governor McKee, we hope, will address. And he's got, a history there. Gina Raimondo had a history there too, but she quickly got swallowed up by the unions. Her husband, as many of you know, Gina Raimondo's husband was I think a principal or investor or something in a charter school group. Many people thought she would be a good educational reform governor. Got into office, and the unions ate her up. Don't know how they do it, but they do it. Similarly, Dan McKee, he started the first ever mayoral academy in America, when he was mayor of Cumberland. And it's become a model that's been replicated in other states. So he's, but already he seems to be backing down. Somebody's already gotten him. He made a statement today that he's not for expanding charter schools right now. Why the hell not? Why the hell not? All right. Other issues that the governor soon to be talked about. So here's the Go Local Prov article I'll be going through. So he's also facing, as we showed you yesterday, a $500 million state budget projected deficit for next year. Here's some pictures of McKee at his first press conference today. And on the budget, his first response is, well, let's see how much federal aid we can get to plug the hole. That's a crutch and that's a crock. I'm sorry. Yes, it's legitimate if the money comes in from the federal, and it's got a much better chance to come in under Biden. I understand that. This is an opportunity to trim our budget down, to reduce taxes on families. I mean, imagine if we could reduce spending on our own, use the federal money, maybe the plug, reduce taxes on people and make Rhode Island a more desirable place to live, work, and receive an education. But no, the governor's the governor-to-be's first impulse is to try to keep things exactly where they are, which is a failed state. We are a failed state. We have the worst business climate in America. You just saw we have among the worst educational outcomes in America. But yet all these politicians want to do is keep to the status quo. So still looking to the feds. That's right. We got to look to ourselves, folks. We got to fix our own problems. We can't be looking for cigarette lawsuit payouts and Google lawsuit payouts and federal bailouts. We've got to fix things ourselves, and no politician in this state has ever been willing to go that route. Obviously, he's making coronavirus a top priority, but this we criticized him for yesterday for two reasons. Is he going to be his own governor, or is he going to continue to live in the shadow of Gina Raimondo? Gina Raimondo proudly said yesterday that Dan McKee has agreed to keep the state's coronavirus response team in place. Again, that's a failed response team. Do you get that? It's a failed response team. We have among the worst infection rates and death rates in the country when it comes to COVID from a medical point of view. And we're also suffering among the worst when it comes to job losses and gross domestic product losses. We have failed on all ends. But yet again, the status quo rules in this state, the status quo. He talked about Rhode Island schools. He's looking to improve schools. Won't be pushing for an expansion of charters. That is unbelievable. That is unbelievable. We have children trapped in failed schools, and we don't want to give them any outs. We just want to keep giving them they don't have time to wait. I mean, if you've got a kid in third grade, does that child have time to wait 5 years for improvements to come? They need a charter school tomorrow to go to have a chance at life. I don't know. Marijuana. I think it's time that happens. Leaning towards an entrepreneurial approach. I don't know what that means. It's better than a government-centric approach, but the destruction of our society, of our young people, the dangers that go along with it, just to plug a budget hole, folks, is immoral. And that's why they're doing it. If you want to change the argument, say there's some overriding libertarian or other value to legalizing recreational marijuana, and make that argument. But to say we're going to take this major societal step that could have such profound impact on young people and everyone in our state, just to fill budget holes, is flat out immoral, in my view. So that's, we have hope for Dan McKee that he won't be as far left as Gina Raimondo turned out to be. But again, we had that same hope for Gina Raimondo, if you recall. And she turned out, she got caught up in the swamp. She got pulled further and further to the left to where she's become, something not much different than a socialist, in my view. Well, Dan McKee, I don't know. Is he strong enough to? I don't know what that pressure is like. I don't know who exerts it. I don't know how they threaten people. I don't mean threaten in a illegal way, but what is the pressure? What is the pressure they apply that seems to just win over everybody to the dark side? And I say that half jokingly, the dark side. So we will have to see if Dan McKee has enough strength, because I do not believe Dan McKee is a socialist. But again, does he have the strength to withstand the socialists? So we're waiting now for Dr. Boston to join us. Larry, did I miss, is Dr. Boston on hold yet?
Not yet, Stan. He should be in any minute.
Okay, just want to make sure we weren't missing him. It's hard for me to monitor who's on and who's not. Again, I'll remind you, if you'd like to ask a question of Dr. Boston or to comment on anything we just covered, rifreedom.org/talk if you want to zoom in, or just call in at that number before, or just put a comment in YouTube. Let me look at YouTube comments right now and see if we've got anything interesting on there. Sounds like Shikarchi gave him the Democrat game plan. I guess that's the status quo. You know, I did hear one good thing today about Shikarchi, and again, I don't know if it's true, but it ties into our talk on Representative Price today. Apparently, we've been told, and again, I can't validate it, but we've been told that when the issue was brought up at a Democrat caucus meeting about formally taking action to expel Price from the General Assembly, apparently Leader Shikarchi shot that down. They didn't tell us why, but I take that as a that's odd. His initial statement seemed to presume guilt of Justin Price, and we criticized Shikarchi on the show yesterday. But I heard something else this morning, and we hope that that's true, because Justin Price may, again, like President Trump, may have been inartful in some of the things he tweeted out, but as Representative and Leader Filippi said yesterday, you don't expel people from the General Assembly for their thoughts. You do it if they do something, do something, they act somehow. That we can't, the part of this cancel culture is this thought police mentality. And if you hold a certain, if you think of, hold a certain political view, or you express certain other views, or think out loud, where people can put you into some mythical bucket, then you should be able to be canceled in our culture. And it just can't go that way, obviously. And it's also the question of how much we're going to put up with it. Again, I want to just spend, before Dr. Boston comes on, I just want to spend a minute reiterating the challenge to you. We read an article in some detail yesterday from Dennis Prager about the good. Are we going to find good Americans the same way there were good Germans during Hitler's Nazi reign of terror? The good Germans knew what was going on in their country, and while they weren't actively part of the horror, they also weren't actively against it. They just sat there like good little Germans and behaved and said and did nothing. We just showed you, let me show it again. We just showed you what former New York Times writer Alex Berenson said. It's stunning, the titanic shift we've had to a country that now cheers censorship. Government, along with big media, big tech, private companies, punishing people for their political views. It's stunning. This political correctness, this woke wave, how it gets through our society so fast. So again, the question is, what are we going to do about it? Are we going to be good Americans or not? There is a way to make your voice heard. If you just go to, very simply, go to GatsbyProject.com right now. Do it. You can open up another window. Larry, if you can put the link in the chat. Our friends over there have got a abolish the cancel culture action you can take. And add your name to the list, which we will keep private. And it also sends an anonymous email, if you choose, to Aaron Regenberg, to Treasurer Magaziner, to Brandon Parter, the state rep from Cranston, the new progressive leftist who first called for Justin Price to step down. And it sends an email to them saying, we disagree with your rush to judgment. We disagree with your lack of understanding of the First Amendment. Please abolish this cancel culture attitude. You can do that right now at GatsbyProject.com. And right at the top of the page, you'll see a link I'm pretty sure, to talk about the cancel call. Okay, I see that Dr. Boston is just signing in right now, so let's get Andy on board, and we'll get into some pandemic-related conversation. Dr. Boston, welcome back in the dugout.
Hi, Mike.
How you doing today?
Okay,
All right, you ready to get right into it?
sure.
All right, you want to go to your charts first?
Actually, yeah, I want to put my cap on, especially since I cut the heck out of my forehead shaving the other day.
No,
Sure. Yes, please.
so that's not naturally beautiful. Your head there.
No, it requires shaving.
All right, well, we're gonna I've got a whole bunch of vaccine-related charts and questions at the end, but let's go through our
Sure.
standard review of state data. So let me share our screen with the charts you send us. And again, thank you, Doctor. I don't know if he's a smart guy, but he sends me the charts ahead of time. So that's awesome. We love it. It's less work for us. Okay, what are we seeing here first, Doc?
So we're seeing what's again reassuring data. I like to present, as you noted, the unhysterical view of things. We're seeing a decline in the level of percent positive cases, and that's reassuring through the last week where we have complete data. So I guess that ends on the 9th. It's very interesting, Mike. As the governor is heading out the door and turning over the reins to the lieutenant governor, she's very upbeat about the fact that the percent positives have been coming down. And now, as she's leaving, she says, well, we still see this large number of cases, but that's because of all the testing.
Right.
That's what she said today. I mean, you can't make this stuff up, but it is a good trend. So there was a slight uptick after the Christmas New Year's holidays, and now we're back. We seem to be back down.
Yeah, and I would note that yesterday's data, while these are full weeks, so we don't have this week's data on this chart yet. But yesterday's testing was the first time it was any single day had been below 5% for quite a while.
Yes.
So that trend is even apparently continuing into this week.
Right, and that's without any of the caveats that we've talked about before about what percentage of these that are positive are occurring at cycle thresholds that are meaningful. So that's just all comers.
Yep.
Same thing in terms of hospitalizations. Now, I was a little reluctant to say we were at anything other than a plateau, but it really does appear as if we're coming down off the uptick in hospitalizations that we saw at the end of the fall into the early winter. It really does seem as if we're coming down in terms of hospitalizations.
And I would also state here that even that uptick you just talked about never got to the hysterical point that they predicted we were going to get to back in November and December. Just like last spring, they were predicting 2,300 hospitalizations.
Mike, that was the more conservative model.
That was the conservative model.
Right. One of the models was over 3,000. People were supposed to be. We literally would have been having the hospitals completely overrun and setting up facilities like, for example, this facility in Cranston, the facility at the convention center. Those would have been filled too.
Yeah, so they were predicting at the low end, you're right, 2,300. Well, we never got even to 400. And then again, when we had this surge a little bit in the fall of cases, again, they were predicting that we're going to get back up into those thousands again. And I think only briefly we got to over 500. And now we're back down to the 300.
And again, a caveat on that 500 number. An official, I don't remember if he was named, but an official was interviewed by John Solomon's Just the News from the Department of Health, and the person confessed that indeed he didn't give the numbers, but there was a significant share of those admissions, late fall, early winter, where the person was admitted for something else. This was the confessional, other than COVID, and but they tested positive at some point. So, you know, we don't really know. You know, the only state that at one point broke out the due to COVID versus with COVID was North Dakota. And they fluctuated anywhere from 25 to 30% typically were excess due to the simply testing positive.
And as you've also noted on recent shows, that some of those hospitalizations are likely not even people who are so sick that they need to go to the hospital. They just went into the hospital to get a transfusion of some kind, whether it was antibodies or remdesivir or something like that.
Treatments that are still required at this point to be in an emergency room or some sort of hospital setting. I think that'll be moving over towards to be more like some chemotherapy treatments that can be infusions
in a clinic or something. Yeah.
Right. So yes, those were all counted as admissions, but I mean, say those were more legitimate in a sense than someone who's in for a gallbladder removal and tests positive.
Right, but in the spring, people were in the hospital because they were really sick.
That's the way it looks like. You know, we never got a breakdown.
Now it may not be. Okay.
Yeah, we never got a breakdown on that. The other thing is that's most important, of course, is deaths. And there again, it really does look like we're beyond that peak that we saw, you know, about a month or so earlier, at least 3 weeks earlier. You know, there could be some lag, but we're certainly at a plateau. But it looks to me now like we're past the peak.
Okay. So layman's questions for you. And by the way, you know, if you want to put a question in the chat for Dr. Boston in the YouTube chat, go right ahead. So I think the flu season typically is right around now through March, right? So are you expecting that similarly COVID cases could rise again now that we're into what is traditionally the flu season?
Well, there's a bizarre phenomenon going on now. I don't really know how to explain it. There is this phenomenon of viral interference, but we are seeing historically low levels of flu. Historically low levels. It should have started, you know, whatever, October. Historically low levels of flu across the United States and in Europe too. And it's again, there was a phenomenon back at there was supposed to be a second wave of H1N1, the swine flu, back in 2009, and there was an outbreak of what's really benign for virtually all populations, rhinovirus, the classic common cold virus. And the hypothesis was that, you know, maybe that sensitized people's mucous membranes in their nose and their mouth and throat to in a way that prevented the resurgence of that had been expected with H1N1 in 2009. But you know, I don't know what's going on, but these are dramatic low levels in terms of the prevalence testing that they're doing for flu that CDC does for surveillance. So I don't know what's going on. But
and, I mean, you're not suggesting that they're purposely coding flu as COVID, are you?
No, all I can say is I'm not saying anything. I'm just saying that the observation is there that for some reason we're experiencing an historically low level of influenza this season. You know, through all the surveillance methods that are in place, you know, routinely each year, each flu season.
All right, before we get to some questions on vaccines, I don't know if we'll have time to cover all three. I got three major areas I want to cover with you, hopefully.
Did you get that slide I sent you about how many vaccines have been administered?
Yeah, well, yeah, I'm going to save vaccines for the next section.
Okay.
But and then if there's time, we'll do the last section. There was a doctor, one of the doctors, Jim McDonald, who's on the Rhode Island response team, had a long interview on the radio today, and he said some things about CC threshold data I want to go over with you. But again, I'm going to save that for the end. So I want to spend about before we get to the vaccine slides and data. I want to spend a few minutes, maybe 5 minutes, on the series of tweets you put out this morning.
Okay.
That I found very interesting. Let me sum it up in layman's terms and let you dig in. So basically, you were saying that it's obvious now, again, layman's terms, that this novel coronavirus is not so new that it's unlike anything else we've seen before, that immunities we might have built up to past colds or past viruses or past flus might be protecting a lot of people from either becoming infected or the severity of that infection of the coronavirus. So there's a lot more immunity out there
Particularly
than
the
we've
latter,
been led to
Mike.
believe. So go ahead, I'll throw
Yeah.
the floor to you.
Yeah, particularly the idea that, and this really is, this is part of what's loosely termed herd immunity.
Okay.
So there's no reason to suspect that immunity built up over the years to coronaviruses, some of which that cause common cold.
This is not the first coronavirus, right?
Yeah, there's 4 that circulate, cold flu season. 4 they're called human coronaviruses now, and one of them may have been responsible for a very serious pandemic-like outbreak at the end of the 19th century. And what happens is that these viruses, they go through a process, they become endemic, they become seasonal, and they become less severe. Either the virus itself changes and or the populations that have been exposed to them are now build up a certain degree of immunity. We would refer to it as herd immunity, natural herd immunity. Doesn't mean that they won't ever get infected. They do get infected, but the severity, that's the key thing. The severity of the infection is less. And what we're seeing, so there was a nice mini review published in the British Medical Journal, which I was tweeting out, and it just pointed out all the data that have now accumulated, which suggests that people who have been documented to have these common cold-causing coronaviruses have less severe infections. It's not that they weren't getting infected with COVID-19. They have less severe infections, that there's cross-reactivity, certainly in terms of T-cell immunity, this so-called cell-mediated immunity,
Yep.
and also that the way we surveil for people who've been infected with coronavirus, with COVID-19, and see if they're quote unquote immune is rather crude. It just looks at a specific class of antibodies to the virus, which can come and go. And
antibodies are kind of temporary, right?
Yes, they can come and go in terms of
T-cell.
Well, 2 things. Yes, T-cell immunity is much more long-lasting. But it's not as if the antibody immunity goes away. That's facilitated by cells that are called B cells. If you do very sophisticated techniques, you will see that there are memory B cells that if you were to expose
Memory
to the virus,
B cells.
That's right. Those are the antibody producing cells.
Okay.
If you were exposed to the virus again, in this case, coronavirus, they could ramp up production, in part stimulated by T cells, to produce very active antibodies that could neutralize the virus to a certain extent. So all these forms of immunity, and this is just, Mike, this is basic immunology, which is no different for COVID-19 than it is for influenza or previous coronaviruses. And the point was, and I thought this was a very a salient point in the sort of mini review letter that was published, was that these principles are not being factored into the so-called models.
Yeah, we're ignoring all past precedent, right?
Yeah, and the models, have been so false and so hysterical. Partly because they just assume that this is an entirely unique virus, and the population is just going to be raw.
All right. So let me ask you a basic immunology question there. So we've heard the term novel coronavirus. Does that technically mean this is a new type, strain of new category of coronavirus we've never seen before? Is that what novel means?
Yes, it is novel in that sense, but it's being pushed to the limit that But
this article kind of says it really wasn't that new, right?
Yes, on one, it's a new species, okay, but that doesn't mean that we, just like with a new strain of influenza, that doesn't mean that we won't have any immunity to it. I mean, and this is what's been pushed so hard, and because of the human cold causing coronavirus connection, that could in part, and some have argued it does contribute significantly to the resistance of children, particularly children below in the pediatric age range, below the age of 17.
Okay.
Because they get coronavirus colds quite commonly, and that could be helping them weather this again novel virus, because there is cross reactivity.
All right, question from one of our YouTube chats from Roland, our friend. So I'll expand it a little. So just to reiterate, the temporary antibodies are temporary. How long memory B and T cells, are those kind of permanent? Or,
yes, yes, that's a key point, Mike. So IgM antibodies are the first to appear, and they're quite transient. We're talking on the order of a few weeks. They'll spike, they'll appear, they'll basically disappear. IgG comes a little later, or can come start to rise around the same time as IgM, but will last out 3 to 6 months, where you could actually measure it pretty easily with routine tests that are called serology.
Now, are memory B cells and T cells developed, or are they natural to any given person?
No, they develop in response to the virus.
Okay.
They develop in response to the virus, and the what's the longest term studies that have been done in terms of SARS-CoV-1. So how long could they be? 6, 8, 9 months show that the T cells and the memory B cells are detectable and persistent. And that's good. I mean, that shows that it's not truly novel in that sense.
Right, and that was the point of the article.
In terms of escaping, normal classic immunology.
Right. It's not so novel that past immunization, self-immunization responses aren't going to have an impact on.
Well, particularly recent infections. I mean, this was the nonsense that was being peddled. That we don't know. Within a few months, there'll be millions of people getting infected again. As you know. Right. That's just not true. There are rare cases, and just like with any other infectious disease, there are rare cases, and it typically turns out that these people have some immunocompromised condition.
Let's move on to vaccines. I got a whole bunch of questions for you on vaccines. So, all right, this first one is the slide you sent over today.
I think it speaks for itself.
Well, obviously, Rhode Island is a smaller state and has
not than West Virginia, Mike. West Virginia is a little bigger than Rhode Island in population, but it's got over threefold the number of people that have been vaccinated, and we don't have any information on the key population. I mean, even just the people that are over 65 in West Virginia have been there's more of them that have been vaccinated in total in Rhode Island. So something's going on here that's not right.
Wow.
And all the hand wringing and all the blaming and everything, particularly that it's a problem of the administration that's leaving office is just malarkey. I mean, these data just put the lie to that. There's something wrong with what's being done administratively in the state.
All right, let's stay with the bad news on vaccines for a minute. Then we'll go to some good news. So there was a little bad news that you also tweeted about today out of
Norway.
So let me
confusing. I would say more confusing than bad, but not good.
All right, go ahead. Explain.
Yeah, I mean, it's a very strange report where on the one hand they're saying that in the population, and actually it brings out another point that I want to emphasize. In the population where everyone agrees that we should try and immunize if possible, the frail elderly, that they're now reporting this uptick in deaths, and yet on the other hand, they're saying they're giving a warning about it, and they're actually considering, well, maybe these super frail, I guess they're calling them, should not be vaccinated at all. And then on the other hand, they say, but many thousands of frail people have already been vaccinated without incident. So I don't really know what to make out of this. But my caveat would be that, well, a couple of them. we're learning about this vaccine. It was introduced. It's a new principle. It was introduced very recently. But the other thing is, take home the message how powerless, how frail these people are. They can die from anything.
Right.
And
you don't know if it's the vaccine, right?
And think about that in terms of how there's this rush, there's this fanaticism, I would say, to label them coronavirus deaths. Bear that in mind when you see data like this. It is so difficult to tell with these very frail elderly.
You die from a coronavirus vaccine. Is that a coronavirus death?
No, it would be a vaccine death. It would be a vaccine death. But what I'm saying though, Mike, is with mass testing and the idea that you're dealing with people who could literally die any day, any week, it becomes just really a ghoulish game with all this labeling.
Yeah. Peter Janito asked, it's something we covered. I'm just going to answer his question. You don't need to answer, but I want to answer. Peter Janito asked, why is there a big push for asymptomatic testing in the state? We covered that last week. You were very, very good in explaining that in the history of all these pandemics and at least these airborne lung-based ones, that asymptomatic spread virtually does not exist, and there's not a reason.
It's not a driver.
It's a crazy policy, right?
Well, yes, it's a ridiculous policy, and even Dr. Fauci, although he's on the one hand, he's in favor of the policy. So was Dr. Birx, who I think everyone should know had to resign in shame because of her hypocrisy. She had to resign early. Because she took her family and multiple generations on a big trip when she was telling everyone to stay home.
Dr. Birx.
Yes, Dr. Birx. They were pushing that very hard. She came to the state, Dr. Birx, to push asymptomatic testing very hard. But the bottom line is, historically, as Dr. Fauci pointed out in last January, asymptomatic spread has never driven respiratory illnesses. Dr. Mermel from Rhode Island Hospital wrote a review about that. And we now have data from coronavirus.
All right. Before we get to the good news, hopefully out of Israel, it's early, it's limited data, but let me ask you a personal question. Somebody I know who's elderly.
Wait 1 second on Israel, Mike, because that tweet.
Yeah, we're going to get to that in a second.
That tweet that I put out was taken down, so something may not have been right with that. I was searching for it again today. All
right, well, we'll look at it in a second, but let me ask you this personal question regarding someone I know who's in their upper 80s, had a vaccine last week, or the first shot.
First shot, okay.
And this week tested positive. So two questions for you. A, how much does the first shot of the vaccine protect you when you haven't had the second shot yet? And B, if you've had that first shot, might that help you fight off the potential infection from the positive test any better than if you hadn't had the vaccine?
Right. So in terms of the antibody response, unfortunately, if getting is the person symptomatic, by the way, Mike?
No symptomatic, but immediately put on antibody treatment.
Right. Because of age, comorbidities,
yes,
whatever.
Yes,
okay.
Yes.
Okay. So it's too soon for the vaccine to have really generated a robust enough immune response. So the person, was just susceptible, and that's not unusual. And that's just from getting the first vaccination. So that will contribute to immunity. But even that first shot, if you get infected in that window before you've had a chance to develop antibodies, and hopefully I hope this vaccine is stimulating T-cell immunity, that would not be the least bit unusual. But the problem becomes that window widens when you have to wait for the second injection. And then even after the second injection, there's going to be another lag before you have a fully robust immune system. So basically, it wouldn't be unusual to be infected within a month of the first vaccination.
But to be clear, unlike other vaccines,
but I think the other point that you made may be more important, which is that probably even one of those infections in this window period, there'd be some immunity that had been engendered by the shot, which would protect you perhaps from more serious outcomes.
Okay, good. And just to be clear, just quick yes or no, because of the nature of these vaccines, the mRNA, you can't catch the virus from the vaccine.
Oh,
right?
no, no, what, no, 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 no. All the mRNA, and it's actually synthesized. So it's
Right.
not even purely natural mRNA. All the mRNA does is stimulate your cell's machinery to make specific protein that triggers the immune response. And as soon as it's doing that, it's relatively quickly degraded. So it's not even around. And it shouldn't really be an issue for false testing really either.
Okay. Okay, so I don't know how much you want to talk about this, given that.
Yeah, because the guy who put this out, I was looking for it, and apparently he took it down. Now, what I'm assuming, Mike, is this little blip at the end, which is
right over here,
right over there, which is what everyone was hoping for. May be an artifact, and there wasn't enough follow-up. That's why I'm assuming why he probably took it down. But his point, his well,
it's what we hope we're going to see, right?
Right, was a separation, but that even though the infections.
Well, explain what we're seeing, even if it's limited data. Explain to everybody what we're seeing here.
Right. What we're seeing is that there's a separation now between the cases themselves and the deaths. In other words, that just like what we were seeing in Rhode Island, where you begin to see it's like a severity index. Like there's lots and lots of positive tests, but the percentage of those positive tests that are turning into fatal cases is smaller.
And it's even more simple than that, in my view. I mean, it's what I think the strategy should have been all along, that if we protect the most vulnerable, which is looking at this, if most people who are dying are in their late ages in nursing homes, and we immunize or protect them first, then we should expect to see deaths start declining relative to
and that's
cases,
why that's why I don't want to become too alarmist about these early data out of Norway, because again, these just like I think many of these deaths have little to nothing to do with COVID itself. They're almost coincidental. That you could say the same thing about the vaccine, because these people are that frail.
All right. Now, this is a tweet I saw. It was on the same string. I don't think it was directly in your string, but it was on a string of tweets I saw along with yours.
No, I saw. I didn't read the entire thread, but I went.
Do you agree that children do not need to be vaccinated
before they return to normal activities? Yeah, no, unless there's some particularly rare high risk category of children, kids with congenital immunodeficiencies, kids with cancer, people who have a high risk, absolutely not. I mean, you could question why they need to be vaccinated at all. But certainly, those are the ones that probably have a lot of cross-reactive immunity from human cold-causing coronaviruses. If they get infected with SARS-CoV-2, they tend to have an extraordinarily mild course. So no, they're certainly not. Mass vaccination is not really relevant to them.
Yep. All right. Just a reminder, we're going to ask one last question to Dr. Boston today, but please, if you're watching live or on replay on YouTube, please hit the subscribe button to do that. It's very helpful to us to show our donors. We live on donations, as you know, so hit the subscribe button so we can show that we're improving our audience reach. All right, Doctor, I'm gonna read you a bunch of points today and have you comment all at once. We don't have time to go through each one, and I'll try to summarize what I heard. I don't know, unless you listened to the radio today, but
about this, yeah, I was curious about that.
All right, so let me summarize. So Dr. Jim McDonald, who is from a part of the Rhode Island task force on COVID, he's spoken at many of the weekly conferences. I don't know what kind of doctor he is. He was on the radio today with one of the other hosts who has been, after.
If I recall properly, I think he's an epidemiologist, but I'm
okay. That's fine. And after we introduced the show, this radio host, we'll say it, Matt Allen. I don't care. Matt Allen has been talking about it as well, and he's had a few other doctors on. So we had.
Right, Mike. I called in and talked to Matt Allen about it. It went very briefly.
Yeah, so a couple weeks ago, right?
Right.
So today, here's what Dr. McDonald McDonald said. I'm just going to give you a summary. I took some notes because Matt Allen questioned him about the cycle threshold data,
Mhm.
which is basically
Specifically the
measures
data from
viral
Rhode
load.
Island or just in general?
Pardon me?
Did he question him specifically about the data that we've put out through the information?
No, he didn't
request?
reference our data. He just talked to him about cycle threshold in general.
By the way, I'm hoping that those data will be published formally, the data from Rhode Island.
Oh, great.
They're in peer review. I can't say what's going to happen, but they're in peer review.
All right, great. All right, so he said, listen, because he first asked him, what level? He said every lab sets their own level, somewhere between 40 and 44. He said it's the PCR test is designed to be a qualitative test, yes or no, not a quantitative test. He's saying that nasal tests, these PCR tests, are really not the kind of test you want to use to actually measure things on like a blood test. He said, which is much more accurate. He's basically saying the science is not settled on PCR tests as to whether you can accurately measure how much. So basically he's saying that the reason we're not publishing this data is that PCR tests are not really designed to be qualitative.
Being quantitative.
Quantitative, I mean. Yeah. So we don't want to so we would never want to read too much into any
Right. But it's enough. It's enough to quarantine people and lock people down and et cetera, et cetera, et cetera. I mean, the hypocrisy is a bit much, and it's getting very tiresome, Mike. Because in fact, then either the man is uninformed or he's actually kind of disingenuous. Because in fact, if you're going to do this mass testing, and particularly asymptomatic mass testing, then you're absolutely obligated to report the cycle threshold values because these, as soon as someone becomes, and by the way, why run it through 40 cycles? Why not 30? Why not 20?
Right, and Matt Allen was trying to get to that and he didn't answer that. Yeah.
Right. Well, because they have no answer. And again, I think it's a little bit toxic to either be ignorant or to be so disingenuous. The fact is that the data that we pried out of them was actually quite informative. When the cycle thresholds rose, comparing, say, March, April to late May, early June, when those cycle thresholds rose in terms of the population of Rhode Island, the data they gave to us, all the critical indices, hospitalizations, deaths in particular, came down. That's good. And the literature, regardless of what Dr. McDonald said, the literature is now quite consistent that in fact, if you're going to do all this PCR testing, then report the CTs because you can monitor populations. It's difficult to monitor individuals per se, but that's the case with any laboratory test to a certain extent. So I think it's very disappointing at minimum.
All right, here. So let me read one more comment. Last question of the day, but I think he kind of shot himself in the foot with this next statement he made. He said because we don't necessarily trust the specific quantitative values of CT as being precisely accurate, that's why we've been going to a symptom-based strategy for determining who is recovered or not. If you're not exhibiting symptoms, we're going to say, after a period, we're going to say you're recovered. Let me finish. And he says, and that's why we don't want you to get tested for, up to 3 months or so after, because you might test positive with some dead cells in your nose. So that's my point. How do you know which end of the bell curve you're on?
At the same time that the governor, or now the governor on the way out, was
admitting there's false positives.
Was ramping up asymptomatic testing where you would overproduce false positives or cycle threshold high positives, which are clinically meaningless. I mean, it's muddle. It's hypocrisy, it's dishonesty, and this is what we get. And again, you sent me a follow-up FOIA request, and now, that's it. The data that were released through June, which obviously we're well past June, in terms of current data going forward, there's apparently they feel as if they have no obligation to release any more cycle threshold data, which is
Do you
the
do you
opposite
trust the
direction they should be
accuracy of
going.
PCR quantitative values?
Again, it's difficult in terms of individuals. In terms of population, if you're going to bother to do all this testing, why not report it?
Yeah. Why not use it as another data point, right? It doesn't have to be the rule, but it's a data point, right?
Absolutely. And it also tracks through with everything else. So when we got this confessional about how people admitted with non-COVID illness are hospitalized but test positive, are counted as coronavirus hospitalizations. Well, Mike, that God forbid some of these people expire. They're counted as coronavirus deaths. They're not admitted with coronavirus by this acknowledgement of the Department of Health. And yet, this is why we need an audit of all the deaths in Rhode Island that are attributed to coronavirus. Because when this was done in Florida, I reviewed the report, and I would say conservatively, a third to 40% of the deaths as they had occurred through midsummer in Florida did not deserve to be classified as coronavirus deaths.
All right, Dr. Andrew Boston, thank you very much. We'll see you next week. I look forward to your tweets and new charts you send us, but thank you for informing Rhode Island about the real news on the pandemic. Thank you, Doctor.
You're very welcome, Mike. Take care.
All right, I'll just finish up with a few thoughts here, and I think I can kind of tie it all together. We talked about a range of different things today, from the DC protests to the cancel culture to pending governor to be Dan McKee to the coronavirus. Now, seemingly, this just occurred to me as I'm listening here. Seemingly, these are wildly different topics, but there is something that connects all of them together, and why our world, why our media, why the left has corrupted everything, why everything seems upside down. No longer is it about medicine. No longer is it about economics, the science of economics. No longer is it about the truth of who did what when the January 6th Capitol protests and then the riots. No longer is it about how businesses, big tech, big media should act. It's all about now the narrative. What seems to happen with this woke, politically correct culture we're in is that for every issue that comes up, the left defines a narrative. We don't care what the data says. We don't care what the economics say. We don't care what you saw between your own eyes, what you heard in Donald Trump's case, where he said nothing insightful, what you heard with what Dr. Boston said, where CT data is critical. There are narratives quickly developed, and I don't know who develops them or how everybody decides which ones to buy into, but think about it. It happens in everything. The narrative becomes the politically correct woke narrative, blinders on woke narrative, becomes the rule regardless of precedent, science, history. No wonder why, I think anyone who's watching the show, you and I see things for what they are. We appreciate precedent. We appreciate science, actual science. We appreciate economic theory. But the narrative is developed apart from all that. That's why everything seems so disjointed, because these narratives have no connection to reality. But yet they become the rule. I think I'm right about this. What do you think? That just kind of occurred to me. The narrative Who defines these narratives? Is there a person somewhere that makes these things up? Who's doing this? And then how do once credible people, once credible news organizations, once credible businesses, once credible media, once credible social media, how does everybody not see that it's a false narrative? And not just get fooled by it, but proactively, aggressively, seemingly gleefully do everything they can to support that narrative, whether it's in reality, based in reality or not. What the hell is going on? How does this happen? I mean, we should really get a psychologist on here. What is the psychology, I wonder, of people just buying shit hook, line, and sinker without a second thought, without any independent thought, without any question, and just automatically not just getting reeled in, but to enthusiastically join. It's like the fish jumping in the boat on their own. Here, yeah, take me. You don't even have to be reeled in. What is the psychology of this? If anybody knows a good psychologist who might have some thoughts on this, I mean, I've kind of thought about this in the past, but listening to Dr. Boston today, there's a narrative out there, right, that this Dr. McDonald appears to be part of. And it doesn't matter what the history says, doesn't matter what medical precedent says, doesn't matter what the data says. We're going to promote this narrative. Who writes these things? I don't know. So we'll bring this topic up another time, but it's so frustrating. I mean, is there a gene in your brain that some people have and other people don't that makes you, whether it's climate change, think of climate change, right? People who just literally are live every day afraid that they're going to be incinerated tomorrow or something. I mean, literally. How does this happen? Does the evil empire implant little microbes in us or microchips in us that alter our thinking? I don't, but it seems that way. It seems like people switch from sanity to insanity just like that. And it seems to all be brought on by Trump brain syndrome. I mean, people who are good conservatives, good Republicans, are now just absolutely off their rocker. I don't know how. Roland says, I believe the dumbing down of American values and principles of the last 20 years have contributed to ease. That's a great point because, you think of Rush Limbaugh's famous line. Liberals are most effective when they come across people, with minds full of mush. Right? That's his famous line, minds full of mush. What that means to me is if you have no principles, if you don't have a principled foundation and belief system that is the basis for everything you do, think, then you are easily influenced by almost any outside force. But if you are rock solid in your convictions, if you are, again, those could be any conviction, if you are rock solid in your principled foundation, if you have that base, you're not going to be blown over by the winds of the day, the politically correct woke winds of the day. So that's a great point, Roland. That could be part of it. That we're purposely dumbing down people, turning them literally into minds full of mush, so that these leftist narratives, like a virus, take hold in their brain. In fact, that's another good thing. Again, Rush Limbaugh, he said it, liberalism is a disease. Well, I think he's right. Wokeism, PC, leftism is just like the virus of the brain. There's another one. Left's not going to like that one, but I don't know how else to explain it. I mean, I'd say that's not a good explanation. I'm sure there's no medical justification for that. Just a wild guy like me ranting. And I admit it's just a wild guy like me ranting, and I can still see that there's a bunch of you watching. So thank you. So I know I'm not alone. But we're going to end on that note before I get myself into any other trouble. Once again, thanks for tuning in for In the Dugout. Mike Stenhouse, we will see you